Mobile introduce themselves and tell you a little bit about it here in just a minute. But as we looked at it and evaluated it as an institution, one of the things that we liked is we thought it would be a substantial enhancement potentially for patient safety. We piloted it a few months ago. We are convinced that it did improve patient care. We're now introducing it and integrating it with our full information technology system here. And we wanted them to kind of tell you a little bit about it and kind of show you how it worked as it relates to enhancing that patient safety component here for our care.
So first I want to applaud the leadership of Grandview, because they had the vision and they are the first hospital in Birmingham to deploy this technology and to improve patient safety. And as Mr. Granger mentioned, the technology is designed for early detection of patient deterioration. So it is a continuous monitor, and it's the first FDA-approved body-worn device, a monitor that continuously monitors all the core vitals for the patient. So it monitors your heart rate, your pulse rate, respiratory, your SpO2, your skin temperature, and your blood pressure. So the model today is spot checking, where they would take every 2 to 4 hours, they would go around and they would check your vitals. With Busy Mobile, it is mobile, so the patient's not tethered to the bed. And this is the device here. They wear it on their wrist. This is all the vitals that show up on the screen. And so it transmits this data to the workstation, so it gives you real-time information and is continuously monitoring that patient, so the nurse is always connected to the patient. So if she views it on this screen, it also is being pushed out to the nurse's phones, so they get alerted if there's any alarm that they need to take care of for the patient. It also is going to be integrated into the electric medical records, so that, again, the nurse is
early that we took down individual dry erase boards that had magnets, that had maybe special drawings or paper, better yet, a paper clip hanging something on, or additional messages on the bottom, and we have an individual vertical board in each one of our med-surg rooms that is capturing all data from our electronic medical record. So we're going to have part of the care team on this board. We're going to have the pain measurement scale and how that interaction goes between physician, staff member, and patient, in addition to goals or upcoming tests or things that need to happen on the schedule for that day, some activities that are specific to your discharge, and then you can see these little applications or icons at the bottom that describe what our team knows as indicators of things that they need to be looking for or how they need to be interacting with patients. And it is a patient experience system. And right over here is the actual pillow speaker that the patient will have with them at their bedside at all times. And it's just literally like an application on a phone that I'll be going up, down, over, and select, and be able to go through each individual icon. So on the My Care, you've got My Care team, you've got expectations for discharge. As we get more sophisticated, we'll have probably more disease-specific or diagnosis-specific. We're going to have other indications on all the entertainment categories. If y'all have seen Children's, this is Get Well product. It's similar, but this has a number of other different activities throughout the system that you can engage. This has free movies, it has TV, a TV guide. At some point we're going to evolve to be able to have a individualized dining experience where, again, this product directly connects to the patient medical record.